Today on the Diabetes Podcast.
There are at least 42 factors that affect your blood sugar levels.
42.
It turns out your brain has insulin receptors all over it. It's not willpower, it's neurochemistry, which is very strong. And your brain is literally not receiving the I'm full signal.
Like complete communication breakdown across multiple systems simultaneously.
Absolutely.
Hello and welcome to the Diabetes Podcast. I'm Richie.
And I'm Amber.
And Amber, little over a year ago, you came to me and said, we're going to do a podcast. And in true Richie form, I said I want to do a podcast. I think I replied something along the lines of, I don't know how to do that. And still don't, but we're doing our best.
You're doing good.
We started out with DeFranzo's Dirty Dozen, the 12 horror defects of diabetes.
Yes, because you didn't know those existed.
Didn't know it existed, and
I've worked in diabetes 20 years.
At least 12 weeks of content that we knew what we were going to do without having to plan out a lot. The downside of that was, first off, you listeners who have been with us from the beginning got some very high level stuff kind of shotgun blasted right from go without a lot of polish on our parts. It's a lot to take in. Still exists out there for those that are interested. However, we thought it would be prudent, now that we've gotten our rhythm together a little bit better, to maybe revisit those 12 core defects probably a little bit quicker than we did originally.
Yes, less steps, let's more
distill this down.
Tips.
Yeah, yes. Distill this down into what you guys need to know to really understand the complexity of this disease, and furthermore, what you can do to attack this thing on all fronts.
Yes. So a common thing that I hear from people regarding their blood sugar, people with diabetes, is that they feel like they're almost being sabotaged by their blood sugar, by their body sometimes. So I thought a good goal for today's episode was to at least begin to have people not feel that they're being gaslit by their blood sugar numbers. So one thing I hear a lot is, I ate the same thing yesterday that I ate today. Yesterday, my blood sugar was beautiful. Today, it was over 200. Like, what is going on? Why is this happening? And to really understand why it's happening, that's the ominous octet piece to bring in, what started with Dr. Ralph DeFranzo with the ominous octet, and then expanded through the research of other prominent scientists to have these 12 core defects of type 2 diabetes. So we're going to explore 4 of those defects in this episode in more practical terms. So we're going to kind of bring it together.
Just doing a little bit of math. We're going to cover 4 of those today. So this is going to be a 3-part series.
Yes.
Okay. Very good.
So the idea is to stop that feeling of being gaslit. I think it's important to understand that there are at least 42 factors that affect your blood sugar levels. 42, give or take, some overlap, there. Can you name a few? Can you take a guess? If you're listening, try to guess some.
I'm guessing we talked about sleep in some previous episodes, sleep being a pretty big lever. Stress?
Yeah.
Hydration?
Yes. You're doing good.
That's all I got.
3 out of 42. Well, all right. You did good. You mentioned sleep, stress, but also the quality of your sleep, more specifically cortisol, which is in alignment with stress, pretty much illness, inflammation, menstrual cycle, puberty, hormones, all kind of in that bucket. The time of day, the composition of your meal, carbs, fat, protein, fiber, which we've also talked about, the order of eating. You mentioned hydration, muscle mass, exercise timing, exercise intensity. yesterday's activity, even heat, sunburn, cold, altitude, caffeine, alcohol, medications, especially steroids, which we'll talk about later, injection site absorption, if you're injecting insulin, the severity of insulin resistance, which has to do also with visceral fat, how much visceral fat you have, liver glucose output, metabolic flexibility, gastric emptying, pain, anxiety, adrenaline, circadian rhythms, insufficient sleep. We mentioned recent low blood sugar. If you had a hypoglycemic event, that can affect your sugars for the next 24 hours. And expired insulin. That's just to name a few. And a lot of those do overlap and interconnect. So
it's so simple.
I don't think, right? just stop eating bananas.
Yeah, those. I did not hear the volume of white food that you consumed in the past 24 hours.
It was kind of encompassed in carbohydrates to some degree, but no, white foods were not in there because onions don't really have a big effect on your blood sugar, nor does garlic, especially not fermented garlic.
Coconut.
Yeah, it's more fat.
Yeah.
So let's start with what people notice first when they have this whole, my blood sugar did something different than the other day, or the big one is I went to bed, my blood sugar number's great, like 100, 105, and I woke up the next morning and it was 175. I swear I didn't get up in the middle of the night and eat any sugar. Like, what is happening? I didn't eat anything. I was asleep. Why did this happen? What's going on? Is my continuous glucose monitor broken? Is something happening? So that is called the dawn phenomenon. And it's this surge of hormones that release before you wake up in the morning. Because in more historic times, you might get up in the morning and go chase your next meal or go hunt and gather. So it's to give you that rush of sugar in your bloodstream before you wake up and go and travel and do. So that is what's happening there. So me in the morning, I usually do go and work out and do something works for me. But other times I might just be getting some coffee, which is a lot of people will also say that raises blood sugar. So caffeine and sometimes just uncaffeinated coffee, people will say has a reaction on their blood sugar. So the idea is that your body is still running on this kind of caveman physiology. And it releases this wave of cortisol, this wake-up hormone, growth hormone, plus glucagon. And all of those hormones knock on the liver's door and say, hey, buddy, we need some glucose. Put us out some glucose. And we got some buffalo to go chase, maybe. And the liver, being this obedient little soldier, says, every time it says yes. And in somebody without diabetes, the pancreas releases insulin to match that glucose that was being released. It goes into the body cells. Your body cells have energy and the blood sugar stays stable. But in type 2 diabetes, or even in type 1 when you don't have insulin there, but especially in this pathophysiology more closely matches type 2. So we'll talk about that. But you have, number one, a tired pancreas that's overworked. And so it's not releasing maybe as much insulin, or it's releasing more, but there's the resistance there. It cannot match the demand either way. And two, the inappropriate release of glucose by the liver. So the liver is overeager. It's like, yeah, got it. And overproduces and dumps more sugar than it should. So you wake up high, not because you ate in the middle of the night or anything that you did. It's because you have a liver. And so I've said this before. I'll say, you have a liver. And people look at me very quizzically, like, what are you talking about? But it's like your hormones threw this party while you were asleep and ate lots of cookies and junk, and they didn't invite your insulin.
So the liver basically, if I understand correctly, the liver is doing what the signals are telling it to do.
Yes, the liver is
It's not
behaving.
necessarily a
Liver's doing
liver
what it should do.
dysfunction.
Mhm.
It's that the liver is getting orders to release sugar, perhaps at inappropriate times, but it's not a dysfunctioning liver.
Right.
It's a incorrect signaling of the liver to produce it. It's the wrong order.
Yep. So, and what's, I guess, most frustrating about this is people are instructed maybe just to eat better when something like this happens. And it's just like, I did everything right. I didn't, and the person did not cause this. That's the liver, as you said, doing what a liver does. That's what it's doing. So I mentioned, I think I did, when I talked about the things that has the liver put out glucose, cortisol is one of the things that gets released.
And that's the stress hormone?
Okay, so that's often what people think, like, yeah, it's a stress thing, but it's so much bigger than that. Cortisol is your liver's, well, it's your, like, there's a tiger attack, kind of fight or flight hormone that's happening. And your adrenal glands, which are little walnut looking things that sit atop your kidneys, they pump out cortisol whenever the brain perceives a threat. And the brain doesn't know the difference between an actual tiger and a frantic email from your boss, has no idea the distinction between the two. It just does what it does. So your brain just reads it as a threat and floods the body with cortisol. And cortisol's whole job is to make sure you have quick, readily available energy for the fight or flight response, the decision you're going to make to fight or flight. So energy in this case is meaning sugar in the bloodstream right now and available. So cortisol is basically yelling at every single part of your body, go, 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 give me sugar now. And it does it in 4 different ways at once, which is why it makes it so powerful. It's very powerful, keep you alive type physiology that normally would work beautifully, but in today's society gets a bit
it's a life or death reaction to a non-life or death situation.
Yes, very well said.
I've never done that.
Yes. Yes. So number 1, cortisol tells your liver to dump sugar, which we talked about. Number 2, it tells your liver to make new sugar from protein. And 3, it tells your liver it tells your fat cells to release fatty acids. And number 4, it tells your muscles, hey, don't take in sugar right now. We need it in the bloodstream for emergencies. So cortisol is creating insulin resistance on purpose, because if you're being chased by a tiger, you don't want your muscles hoarding all the sugar. You want it free and available for the chase. And in normal life, it's a beautiful system. If you got chased by a tiger, you'd be very grateful that you had cortisol doing that job. But the problem is that it's constantly turned on. It's the emails, the calls, the homework. I remember when our kids were in 3rd and 4th grade. Oh my gosh. The homework, the news, the overdue appointment that you're rushing to, your body treats all of those like tigers, and it's not a life or death situation, but oftentimes we feel that way and our body is reacting that way. And the problem when the tiger never goes away is that your blood sugar can just stay elevated as a result. And if you have type 2 diabetes, you don't have the insulin reserves to clean it up. Or if you have type 1 diabetes and you don't match the insulin with the sugar in your bloodstream, and that means you need to know when the insulin starts to work, when it peaks, what the duration of the insulin is, all of that, then it can be problematic. So it's not that cortisol is the villain or that the liver isn't doing what it's supposed to. It's modern life. It's the environment very much. So we're not going to shoot the messenger, cortisol. It's doing its job. So it's almost like the body evolved thinking that if you're stressed, you're going to move. And modern life is more like if you're stressed, you're still sitting. You don't necessarily move. And that's why it's a good recommendation if you're feeling kind of wound up or stressful to get up and kind of move that out of your body.
I've thought about this when walking the dogs. When they clearly see another dog or somebody that they don't like and that the hackles are going, you can visibly see that they're going into probably fight, given ours, but they don't fight from nothing. But when the other dog has passed, when it's in the rearview mirror, all of them will in mid walk do like this violent little shake thing, and then they're back to happy tails wagging and all that other kind of stuff. I've tried doing this when I get kind of flooded a little bit. It doesn't work so well in humans, but I think it's what you're saying is kind of the same thing. In general, maybe it's just that the volume's not appropriate for my response. But if I were to maybe vigorously move for maybe a longer period or more intense period, that may clear some of that cortisol.
It could. Dancing, moving around, shaking, moving it out. Okay, so now we're going to focus on the liver more. We did an entire episode on the liver and those 12 core defects. Episode 5.
Hepatic glucose production. Yeah.
So here's the short version. Your liver is a sugar bank. It stores about 100 grams of glucose at any given time. Stored version of that glucose is called glycogen. So glycogen stored in the liver can also be stored in the muscles to a much higher degree. And training can affect how much storage can be in your muscles. That can be very highly variable in a trained individual. We can also make brand new sugar out of protein and the glycerol backbone of fat. And that's called gluconeogenesis, the making of new glucose from other products.
So this is, if I'm reading between the lines, my liver would be doing this more if I were on a low carb or a no carb diet, correct?
Definitely, because you need your calories, you need your energy, and that's one way. Okay. So in someone without diabetes, the liver mostly is quiet in between meals, because when you eat a meal, insulin is released, and insulin is the button for the liver. And it's going to dump just a little bit of sugar to keep the glucose between about 80 and 90. But in type 2 diabetes, the liver is overactive. It's dumping like 2 to 3 times the amount of sugar that it does. And the reason is that insulin. It's like the hormone that says, hey, liver, chill. And I think of it like the liver is our teenagers with their headphones on when we're trying to talk to them. Like maybe we're insulin.
The really, really excellent noise canceling headphones that we got them for
and
Christmas.
We're trying to talk to them and they completely are ignoring us. Meanwhile, the other hormone, glucagon, is talking to the liver as well, and it's screaming, make more sugar. And the liver hears that one loud and clear. So I'm guessing in this example, glucagon are their peers.
Or maybe what's playing in the headset.
Maybe so. Yeah. So insulin is telling liver to chill. Glucagon is telling the liver, sugar. Dump it. And in diabetes, the liver hears glucagon, but ignores the insulin. And that's also one of the core defects. That's the alpha cells. And it's why your blood sugar goes up between meals, overnight, and during stress. So we've got the teenage liver listening to the music and ignoring the parents or their friends' bad influence. Anyway, so now we're going to focus on glucagon, the music in their headphones, if you will, or the peer pressure. I think that a lot of people have heard of glucagon, especially people who are taking insulin. They might have been prescribed glucagon. And as an aside, they do make injectable glucagon, but you would not be injecting that in for yourself.
Doesn't GLP stand for glucagon?
It's a glucagon-like peptide 1
Yeah.
receptor agonist. So it's acting on the receptors for glucagon. But yes, that's very insightful because it does help block. No, you're right. It's blocking that glucagon. Very good. It's putting the kid on restrictions so they can't hang out with the kids. Sorry, we're not bad parents. But anyway, maybe that doesn't mean you're a bad parent. I'm going off track. Anyway, glucagon is just loud, essentially. It's not bad. It's just loud. And your pancreas has 2 types of cells. It's got the beta cells, which we've said before make insulin. And then the alpha cells of the pancreas make glucagon. Mm-hmm. And so you can think of it like insulin is the lower glucose hormone and glucagon is the raise the insulin hormone or lower the glucose. And they work together like a thermostat. And so insulin cools the room down and glucagon turns the heat up. And in someone without diabetes, when the blood sugar gets high, the alpha cells go quiet. They stop making glucagon. They say, okay, the room is warm enough. We can chill. But in type 2 diabetes, the alpha cells don't shut up. Even when the blood sugar is 200, they're still blah, 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 telling the liver to make more sugar by pumping out glucagon.
So tell me if this makes sense. The analogy that comes to my mind is a broken thermostat that's running your air conditioning and your furnace at the same time.
That's not a bad analogy.
And as a result, you're just uncomfortable and you're wasting a bunch of energy. Right. Everything's going almost full tilt. But if I turned the furnace all the way up and I turned the air conditioner all the way up and I had a broken thermostat that would allow them both to run at the same time, again, the house is just uncomfortable and I'm just wasting a ton of energy.
Yes, but it's even more on the heater side of it. Yeah. So it's not just a little bit, 1 or 2 studies or a little bit more. This is huge. Dr. DeFranzo's research shows that fasting glucagon levels in type 2 diabetes are typically 50 to 100% higher in people with diabetes than people without. Not insignificant. So it's interesting because we've talked a lot about insulin. We've been blaming not being able to hear the insulin a lot, but not so much emphasis on the role of glucagon. And it's really the other half of the story. And what's interesting with that is some of the newer GLP-1 receptor agonists are now coming out as triple therapy drugs where it's glucagon like peptide 1 receptor agonist, your GIP, and then which is your insulinotropic polypeptide. And then you have the glucagon component that they're adding into that, which is quite interesting. Anyway, that I think Eli Lilly just released their version. I think that was the retatrutide that we had heard. Anyway, that's an aside. Okay. But glucagon is why the GLP-1 medications work so well, is this alpha cell dysfunction that's going on because they calm down the rowdy alpha cells. They tell the glucagon, like, simmer down now, maybe take a nap. And so we covered that in episode 1, 23, and 24. If anybody wants to go deep dive there. So far, the cast of characters we've talked about affecting your blood sugar are cortisol, glucagon, the inappropriate release of sugar in the bloodstream due to cortisol, glucagon, this sort of behaving yet misbehaving type going on of the liver. And we haven't touched on the brain yet and brain insulin resistance, which is the most recent core defect that's been discovered, number 12, not the order. And this one I think is quite fascinating because even though it's called brain insulin resistance is not exactly this. It's not the same mechanism as the way we've talked about insulin resistance that has to do with liver and visceral fat and things like that necessarily, because the brain can work and can get sugar independently of insulin. So what does insulin resistance matter if the brain can function without having to have insulin? But the original thought was the brain runs on glucose, end of story. It can get glucose without insulin, the end. But it turns out your brain has insulin receptors all over it, especially in an area called the hypothalamus, which is your control center for hunger, satiety, and metabolism. And it's also another place in which the GLP-1 receptor agonists work and why they can help so much with hunger and satiety, that plus the delayed gastric emptying, which we've also done anything meds can do, your body can do better, your diet can do better. We've talked about that in those GLP-1 episodes as well, like natural ways to help with that, to increase your blunting of that effect. So insulin isn't just talking to your muscles and your liver, it's talking to your brain constantly. And when insulin reaches the brain, it does two huge things. Number one, it tells your brain we are full. It's okay to stop eating because we're full. And that might be delayed about 20 minutes. So you can eat a lot of food in 20 minutes time, which is why it's also recommended for mindful eating and eating more slowly. Number two, it tells your brain, hey, get that liver under control. Tell it to chill out. Stop dumping all that sugar. And it does this through the vagus nerve. So it's almost like the brain and liver have this hotline connection to each other. But in brain insulin resistance, the hotline is down. Or you've got a really talkative couple of people working the hotline. When you've got other people calling in, they're just ignoring those phone calls. And the brain doesn't get the messages that it's supposed to get. So you eat, your blood sugar rises, your insulin rises, but the brain still feels hungry. And it still tells the liver, like it doesn't get that message to the liver to stop dumping sugar. And both signals up and down that vagus nerve are broken. So you're hungrier than you would be. And your liver is leaking sugar like a faucet. And that's just this recipe for high blood sugar, weight gain, and a brain that just doesn't feel. And this is something I've heard a lot from people. I just never feel full. I also hear some other people say I never feel hungry, but that's another kind of sometimes an effect of neuropathy and other things going on there too. Or people on GLP-1 sometimes. So I hope this has given you a lot of compassion if you're listening for yourself or for others who may have been told or been judged that they didn't have any willpower. Or if you felt I've never had the willpower, that if I just had enough willpower, I could do this. It's not willpower, it's neurochemistry, which is very strong. And your brain is literally not receiving the I'm full
it's
signal.
Like complete communication breakdown across multiple systems simultaneously.
Absolutely. Yeah. Okay. So the hopeful part is that brain insulin resistance responds beautifully to sleep, exercise, and lower inflammation. And we do have the brain insulin resistance episode, but particularly lower stress type activities, walking, talked about a lot. Walking is a good one. Getting enough sleep at night.
I came across some interesting research that there's actually like bonus benefit for walking outside as it relates to the brain.
Yes.
That there's something, and I think it has to do with kind of variety of visual inputs, but that there's also kind of interpreting what the ground's doing in real time and all that other kind of stuff. So even though your muscles are effectively doing the same thing as if you would be on the treadmill at the gym, your brain's having to work harder if you're outside. And that tends to be just like after I do the workout, my body feels that kind of high. From a brain standpoint, that's good work for the brain. It's not mind crushing accounting and doing paperwork and all that other kind of stuff. This is what your brain kind of craves, that new visual input and that kind of having to negotiate outside. You still get credit for walking, but you get extra bonus points if you're going outside and doing, at least from a brain activity standpoint.
I like it. And then from a nutrition standpoint, back to brain insulin resistance and what it responds to, decreasing ultra-processed foods and increasing omega-3 fats, which could be from walnuts, salmon, things like that. Very boring superhero team of sleep, walking, omega-3 fatty acids. All right, we're going to talk about stress belly.
Stress belly,
cortisol gut, all those fun little. I didn't make these words up. I've just heard them online through different marketing things. Okay, so why does stress make you gain fat, particularly in your abdominal midsection area? And what does it have to do with blood sugar? Oh, you're going to try to answer it. Go, Richie.
The hamster's working. Working hard. I'm guessing. I believe that cortisol increases inflammation.
You're doing good.
Increased or sustained inflammation tends to increase visceral adiposity. So one domino kind of knocks the other domino, which leads to over long periods of time, sustained cortisol levels ipso facto should increase the amount of visceral fat that you have surrounding your organs. And as we talked about in previous, just piling on that little pancreas that's struggling and doing its best under not ideal circumstances.
I am such a proud parent. That's gross. No, I'm not your parent, but like
Nope.
proud moment, teacher moment. Yeah. So cortisol does two contradictory things to fat in your visceral fat. So visceral fat is the fat around your organs in your belly. Cortisol tells the fat there to store more fat. But in the rest of your body, cortisol tells the fat there, the cells there, to release fat. So you're simultaneously storing fat in your belly and dumping fatty acids in your bloodstream from everywhere else. And we have a cholesterol episode that dives into that a bit. And then episode 4 also talks about some of that. But why it matters for blood sugar is those fatty acids that get dumped in your bloodstream, they travel to your muscles, to your liver, even your pancreas, and they gum up that is insulin resistance. And in this way, stress causes fatty acids to leak, and fatty acids cause the insulin resistance, and insulin resistance causes high blood sugar. So that's the progression there. And now your liver is storing those excess fatty acids, which can cause fatty liver and even more insulin resistance. So it's a cascade, avalanche, just exactly what you said. And to think, we used to think fat just sat there and was maybe unsightly, does all this stuff. We now know that fat, especially visceral fat, is an active organ that pumps out inflammatory signals and pumps out hormones and is actively making things worse. And that's why losing visceral fat especially is one of the most powerful things that you can do for insulin resistance and type 2 diabetes. But as we all know, you cannot spot reduce. So
and we talked a little bit about it before. Like, I don't think you can even liposuck visceral fat. It's
probably wouldn't be good for your bowel perforation in there.
So it's not like a cosmetic surgery where if I had the finances, I can just go and get it siphoned off. Like, that's in there. And sorry to be the Debbie Downer, gonna have to do some work to get that off. It doesn't have to be like today, but sustained increased work over time is necessary to reduce that visceral fat.
Yep.
Yeah.
Billy Blanks and Ty Bo is very upset by this news.
Oh yeah.
Yeah.
Why's that?
I don't all the spot reduction stuff in the 80s,
Oh.
Melt the fat off your abs.
My favorite one was the Thigh Master. Like
Jane Fonda.
It wasn't Jane Fonda, it was Suzanne Summers.
Oh, Suzanne Summers. Okay.
But like that was going to meaningfully restoratize my lower body.
Gets rid of that fat in between your thighs. No?
No. It does not.
Yeah, so the way to reduce visceral fat is by reducing overall stress, getting better sleep, walking after meals, and eating in a way that can help keep insulin in check, which would be more fiber, more beans. And you were waiting.
No, honestly, I was, I got to give a shout out to Stanley Bronstein. For me, it was just giving up dairy. Giving up cheese. That was the last kind of lever. As soon as I pulled that, like it just started dropping. It
did. I would say you've always been lean, but you had some visceral, noticeable visceral fat. And I say that with love, there was some visceral fat, and it showed in your labs as well that there were some beginnings of insulin resistance.
Triglycerides were high. There was a lot of stuff going on.
Cholesterol was high. And now I think that I've very noticeably seen your waist size go down and the fat in that area reduce, but not subcutaneous. Like it's a more circumference
it's
of
the weirdest, like again,
I would say the love handles
targeting
are the
of an area reducing that I did not know that mechanism existed. And for me, the solution was just giving up the cheese.
And before that, you also increased your fiber quite substantially.
But I've been doing that for a while.
Yeah, I would agree.
That I think, and maybe it was just that last little straw that broke what's an upside down camel? I don't.
A camel on your belly?
Yeah,
I don't know.
That thing. Yeah. Yeah, just
you didn't have a camel on your belly.
The dairy, and by dairy, really for me, it was the cheese. I had some bad habits as it relates to cheese consumption.
So since we mentioned cortisol, I want to take a little side trip into steroids.
Okay.
And so cortisol would be the steroid that your body makes, if you will. And then you have external exogenous steroids that come in a syringe, a pill, a bottle. Prescription steroids, AKA also known as prednisone, dexamethasone, cortisone shots, even some inhaled prednisone or inhaled type steroids. These are synthetic cortisol, and they are way more potent than the cortisol your body makes and will absolutely wreck yourself. Like chickadee check yourself before you wreck yourself type damage to blood sugar. So I'm going to walk you through when somebody gets prescribed prednisone. So I'm just going to make up somebody. We'll call her Linda. Linda got really bad poison ivy, as my grandmother and I both did anytime we had our family cemetery cleanup. That was the thing. So Linda went to urgent care. They gave her a Medrol dose pack, 6 days of prednisone tapering down. Very common scenario, happens every single day. Linda's A1C was below 7, 6.8, pretty well controlled. She comes home, takes her first dose of the steroid with breakfast, and then 12 hours later, her continuous glucose monitor was reading 280. She said, this thing's broken. Thankfully, because Linda knew to have a backup method, she tests her blood sugar with a finger stick, 285. Uh-oh. So this is real. And in a panic, calls me, and I explain, you're on steroids, Well, I had to ask some questions to get there, but he says the prednisone is going to do this for the next 6 days. So firstly, you cannot stop the steroid without your doctor's approval, because the doctor puts you on that steroid for a reason. And steroids are very, very powerful medications. They do an amazing job getting you over that bacterial infection that just wouldn't budge, or poison ivy, or that pain that you were having, so you feel like a normal human again. You know, they're treating something serious with those oftentimes, and you can't just quit them cold turkey, especially if you've been on them for more than a few days. So it's very important disclaimer. You need to communicate with your physician. Second, expect a spike. Knowing it's coming makes it way less scary. And I wish that doctors spoke with their patients who have diabetes, especially. But I mean, steroids can make somebody who, so when I used to work in the hospital, people who had an organ transplant per se, who did not have diabetes, would need insulin for the mega steroids that they had to keep from rejecting the organ.
Oh, wow.
Oftentimes just initially until they found like their maintenance dose of steroids to not reject the organ. But so imagine you just got a new organ and now you're also injecting insulin because the steroids have made your blood sugars crazy high. So I wish that was discussed more with people.
And if I'm kind of reading between the lines, chances are you're probably not going to be able to move as much as you want to even be able to utilize that GLUT4 pathway efficiently.
Depends on the situation. Yeah, I mean,
but
a lot of situations.
If we're talking about having an organ transplant, you're probably in bed. So, I mean, you're really,
that person.
As far as getting my big movers going to be able to siphon off some of that sugar from the bloodstream, that pathway is just not available. So you're kind of stuck.
No, I mean, yeah, a lot of times you would be on these steroids because you've got some sort of infection that's winning, a little bit. And so a lot of times you are unable to move as much as you would regularly move, especially. So yeah, it's important to know that's happening. So you can focus on 3 things: movement, if possible. You can have a food strategy, and absolutely communicating with your prescriber. So let's go through movement. A 10 to 15 minute walk after every meal can drop a steroid spike by 30 to 50 blood sugar points on the meter. Your muscles, we talked about this GLUT4 pathway. Your muscles can pull in glucose in the absence of insulin, or even without needing much insulin. And we talk about that in episode 3. So when steroids are jacking up your blood sugar, walking is a very important tool to pull out of your tool belt. And then with the food strategy, you can temporarily, so we did an episode that carbs are
case for carbohydrates.
So in this situation, it would be prudent probably to reduce carbs temporarily. Not forever, just while you're on the steroid. So
certainly your refined sugars.
Absolutely, yeah. But load protein and non-starchy veggies, and don't graze. What I mean by grazing is like frequent small meals, which is often a very a strategy for some people.
Just to keep the total number of carbohydrates.
But with steroids, steroids love grazing, and they'll use a little snack to spike you up again. So eat full meals and walk afterwards. And call your doctor if your blood sugar is consistently above 250, or if you're seeing 300 or higher. If you feel terrible, call your prescriber. They might need to temporarily adjust your diabetes medications. Some people, as I said, with the transplant patients especially, might need a short-term insulin bump while they're on a steroid. People who have type 1 diabetes on an automated insulin delivery device might need a different carb to insulin and correction factor while they're on this. And a lot of times the insulin pump companies can walk them through the changes that their doctors suggest. But it's okay if you need a change short-term. That's not a failure. That's just being smart about matching the insulin to the medication that you're taking. And it's a really important reframe, because I think a lot of people see more medication as losing, and temporary medications adjustments during steroid is playing chess. It's not losing at all. So steroids have a delay in when they spike your blood sugar. So when you take prednisone with breakfast at 7 in the morning, let's say, the medication has to travel to your liver, get metabolized, and then it starts doing its work. And the peak effect usually shows up about 48 hours after taking that dose. So if you took it at 7, your biggest spike might be between like 11 a.m. and 3 p.m., which is right around the time that work gets more stressful, or you're having lunch, or you're snacking on something that...
So expect lunch to be wonky, is basically.
Possibly, yeah. So steroids plus work stress plus some kind of sad sandwich at your desk plus no movement could equal a blood sugar of 280 and sometimes above. So timing matters. If you know that spike is coming at lunch, you can plan around it. Have a lighter carb lunch, walk before and after lunch. In this case, not just after, but before and after. Hydrate, make sure you're getting plenty of fluids. And then by mid-afternoon, the peak can kind of pass, and then you can say, do I need to take another walk after dinner, or what's going on? And then depending on the steroid, it can take a while to clear out of your system after that. So prednisone is usually mostly out of your system within 24 hours of your last dose, but the metabolic effects can linger for 2 to 3 days, and then a cortisone injection can last for 2 to 4 weeks.
Oh, wow.
So, in fact, a client of ours who has latent autoimmune diabetes and is only on a basal insulin, they were about to start her on a cortisone shot. And I said, there is no way you're going to start that cortisone shot without having rapid acting insulin on, that you have some prescription for that and you know how to take it, because that could throw her into diabetic ketoacidosis. If you need insulin because your pancreas doesn't produce enough and then you're on the steroid that makes your sugars crazy high, you need a plan. So if you get a cortisone shot in your shoulder and your CGM's reading off the hook, that is why. And this is not a waited out in afternoon situation. This is a long game of making sure to control the period of time that you're on those. A lot of people going through cancer treatments might be on a steroid as well. So if you're going through a treatment like this and you're on an automated insulin delivery system or something like that, some of these automated systems, with every pod change, it would increase your insulin dose, and eventually the insulin dose would match the steroid. But then when you come off, it might be too much, and you might need to use the activity feature or the sleep mode or something like that to help as it gets tapered off. So there's different strategies. Highly recommend you talk with your doctor.
Yeah,
and
I can imagine you've been on your automated insulin delivery device for a while, and you've got your algorithm perfected, and you've really got this thing dialed in, and all of a sudden I get a shot, and now all bets are off.
Right.
It doesn't know.
And it's beyond frustrating for people, because they're like, what in the heck happened? Especially if they didn't understand that this could happen with steroids or prednisone, or their doctor didn't have a discussion with a plan of like what to do. And oftentimes the endocrinologist doesn't know that person has a steroid injection coming up to be able to make a plan up with them, especially if they're seeing them every 3 months, or in some cases every 6 months. And those kind of things get overlooked and missed, unfortunately. So something I teach some of my clients about to start a course of steroids is the steroid sandwich. This is a meal pattern that may help protect your blood sugar from the 48-hour spike. It's pretty simple. Every meal, breakfast, lunch, dinner, gets 3 layers like a sandwich. The bread is fiber. The protein is protein. And then the spread is a healthy fat. So fiber, protein, fat at every meal. You want an example? I got examples. I was prepared because I knew you were
sorry. Now you just got me thinking about sandwiches.
Not a sad sandwich though. This is a good sandwich. So like breakfast, you could have 2 scrambled eggs, half an avocado for the fat. So the breakfast is protein, and a side of sauteed spinach for a little bit of fiber, not a lot there. Then lunch, you could do a big leafy salad. That's your fiber. Grilled chicken or tofu for your protein. olive oil and hummus dressing. There's your fat.
And at this point in
Steroid
time,
sandwich.
I'm not sure if that's actually thunder in the background as we're recording, or or my stomach growling on camera.
Oh my! I'm pretty sure it was thunder, but
might have been a bit of both.
Maybe. So where was I? Dinner. Here we go. Salmon, which would be protein and fat, and some of your omega-3 fats, or half a cup of cooked beans, which would be fiber and protein. Roasted broccoli, which would bring in some fiber, maybe a few roasted sweet potato cubes if you can tolerate them, or if you had beans, do some avocado for the fat there. And we're not talking about the sad sandwich again, but if you did want a sandwich, make sure you use high fiber bread and lots of turkey, lots of veggies, maybe some avocado in there for your fat. But the point is the ratio. Most of your plate should be fiber. And this kind of goes with any meal where half of your plate is your non-starchy veggies. Then you've got your fiber, your high fiber starch potentially, and then your protein there. So protein and fiber are going to slow down digestion and blunt the blood sugar spikes and help you feel full. And anything meds can do, you can do better. So you don't need the GLP-1s. They would help with that.
Yeah, the increased fiber really is doing, or at least mimicking, most of the effects that the increased or the exogenous GLP-1 is doing. So, and certainly more affordable, I think. Beans are pretty cheap.
Yes, very cheap. So if you were on steroids or any time if your blood sugar was above 300 consistently, especially if you felt nauseous or super thirsty, confused, just off, to call emergent line, get some help with that, because that could be diabetic ketoacidosis territory, which is an emergency. It's not a wait until Monday situation. Right. A lot of people, and I think we told the story once of the gentleman who walked off of a concrete slab and twisted his ankle and ended up waiting till Monday and had gangrene in his foot. Yeah. And so a lot of things are not a wait until Monday situation. If you really feel that something is off, go to the ER. And then if you take insulin and your usual doses aren't working anymore, call your provider. You might need a temporary increase. Don't tough it out. Get a plan. Ideally, proactively talk to your provider before you have this appointment, please. But if you have to do it reactively, you have to do it reactively. So I think the big thing is it doesn't mean your diabetes got worse overnight, because there's a lot of people that don't understand, they freak out. That's why I wanted to cover this, just to make sure. So we talked about hepatic glucose overproduction. We talked about alpha cell dysfunction. We talked about brain insulin resistance. And what was the other one? Did you say cortisol?
Cortisol. Okay.
Yeah. In the liver, dumping out
hepatic glucose overproduction.
Sugar in
yeah.
Okay. Sorry, I wasn't listening. Full disclosure. It's just you and me here talking, but who else am I listening to? Must have been the thunder. Oh, goodness. So I want to talk about the freebie that we're going to give away based on this episode. It's called the Cortisol Bingo card. So I made this little tool because I noticed that every client has slightly different patterns that can affect their cortisol. Some people are wired and tired. Some people crash at 3 p.m. I tend to be more of a 3 p.m. kind of crasher. Some people can't sleep. Some people sleep too much. Some people have a tight jaw, clenching all the time. Some people have tight gut, but cortisol shows up differently in different bodies. And so got a cortisol bingo card with different squares of symptoms, behaviors, patterns. You check off the ones that apply to you. And by the time you're finished, you see what your pattern is. Like, oh, I'm an afternoon crasher, or I'm a 3 a.m., like I'm a tight shoulders, jaw clencher, whatever that is, because you have to kind of know your enemy to be able to do something about it. You know what to target. think you can kind of figure this out without a bingo card, but this would leave no question. Like that's what's going on. Some people might need less caffeine, some more morning light. So it's personalized, kind of an insightful tool. So any listener who emails support at Empowered Diabetes, notice I put your email, not mine.
Yeah.
I'm just kidding. And make sure the subject says cortisol bingo or bingo cortisol, whatever you can remember. I won't fault you for getting in the ballpark.
Yeah, just send the email. We'll get you the bingo card.
And cortisol bingo, subject line, support at empowereddiabetes.com. That's it. Okay, so some cortisol lowering habits, and then we are wrapping it up because we can't talk about all that and not give practical strategies. That's how we like to end our episodes. So some actual stuff, practical, tangible, 7 habits that can help lower your cortisol and your A1C and blood sugars. So some of these have a more direct effect on cortisol and some of them are kind of like secondary to this other thing. So number 1, morning sunlight. 10 minutes on your face within an hour of waking, because this can reset. It can help with your circadian rhythms, help reset your cortisol curve, and help it to drop properly at night. Number 2, walk after.
And that's within 10 minutes of waking?
No. Sunlight, 10 minutes within an hour of waking.
Okay.
10 minutes of sunlight on your face within an hour of waking.
Okay.
I do this nearly every day. I realized when I was doing this because it's about an hour because I'm up at 5:30 and rowing at 6:30 or sometimes I'm up more than an hour before sunrise, but most of the time I'm not. Yeah.
Okay.
Number 3, protein at breakfast. At least 20 to 30 grams. And I don't normally get that prescriptive, but this can help your blood sugar and your cortisol for hours at this time. So you could do eggs, Greek yogurt, cottage cheese, a tofu scramble, overnight steel cut oats with chia seeds, hemp hearts, and ground flax, because it's the chia seeds and the hemp hearts that give it more fiber and protein and kind of stabilize the blood sugar there. Or if you can tolerate it, a plant-based protein shake. And I say if you can tolerate it because some of those have a lot of pea protein and chicory root fiber, some things that can be a little more gas producing. So just putting that out there. And then number 4 would be slow exhale breathing, 5 minutes a day. Exhales twice as long as your inhales. So inhale for 4 seconds. Exhale for 8 seconds. The idea is to try to help activate your parasympathetic nervous system and signal to your body there's no tiger here. Everything's fine. You can go back to sleep, liver. Everything's good. Then number 5 is sleep. 7 to 9 hours. Easier said than done. But sleep is when your cortisol resets. And it's very hard to hit the reset button when there's no reset button.
It's hard to panic when you're unconscious.
It is. That's right. And then limit caffeine after anywhere between noon to 2, depending on when you wake up.
Because I think is it 6 hours is the half-life on caffeine?
Yeah, caffeine can extend that cortisol curve by a couple of hours. So we don't want the cortisol to be elevated at bedtime. So keeping that at bay. And then number 7, laugh. Genuinely laugh with somebody. Watch a comedy, call your funniest friend, marry your best friend.
Do a podcast with your wife.
Am I not your best friend?
No. It's the same. Usually we laugh on here.
Oh, we do?
I do. And normally at my own jokes.
Look who's laughing. Okay. Laughter measurably drops cortisol within minutes. And laughter, one could say that laughter is an anti-diabetes medication. Good side effects all around. Except if you're me, because sometimes I laugh inappropriately when people trip or fall down. And it's a problem. I'm way better at it than I was when I was
You also
younger.
laugh when you trip and fall down. So it's not.
Yeah, I mean, I'm an equal opportunity. It's not just, but it's hard to explain to somebody in the moment
it's
that
not.
like
It's called slapstick. The Three Stooges did it. There was a whole genre of comedy specifically
there was a
around
lot
people
of Three Stooges in my
getting injured.
and
It's
Looney
really what it
Tunes.
comes down to. Yeah.
Looney Tunes was big. Yeah. Okay. So to recap, sunlight, walking, protein at breakfast, slow breathing, activate the parasympathetic nervous system, sleep, limit afternoon caffeine, and laughter. No prescription needed, only pretty positive side effects. And it could possibly reduce A1C a half to a full point.
Wow.
Bigger than some medications.
Bigger than berberine.
Anything meds can do, you can do
better.
better. That's all I got for you.
All right. Any clues as to what we're talking about next time?
No clue.
But we're going to continue on.
Oh yeah, we're
talking
gonna.
about
No clue.
Listener, you've just gotten an insight into my everyday around here. What are we doing? I don't know.
Oh yeah, I know what we're
Yeah.
doing. We just did the first part or segment A.
Yeah.
We've got ABC. So we did 4 of the 12 core defects that were covered in this.
And we will cover another 4 on the.
It's kind of like that because today we really did like alpha cell dysfunction, inappropriate release of
Hepatic
glucose by the
overproduction,
liver. We
right.
touched on a little GLP-1 action, which is the gut.
Mhm.
We did some brain insulin resistance.
yeah.
So, I think there's going to be some overlap within this because what I want to do is really kind of make it really practical and tell stories instead of.
And take 12 episodes and condense it to 3. That's really
Yes.
the ultimate goal of this here. If you have to
Yes.
get it all, get it in a consolidated form.
Yep. The goal is for you to understand that fermented garlic is not going to cure insulin resistance and type 2 diabetes.
Well, beyond that, that it's not simple.
It's not simple at
there's a
all.
lot going on simultaneously. And unless you have an equally robust plan to combat it, it's unlikely that just doing one thing or even just taking one medication, we do talk about this on the 12, like one medication does not affect all 12 dysfunctions. That
If it
doesn't
did, if you had one ring to rule them all, you would not need the others.
I mean, honestly, that is probably movement. I mean, that really is the big kind of affects everything.
What did you say?
Movement.
Movement. I thought you said Reuben. And I'm like, I don't know this Reuben ring.
Reuben sandwiches fix everything. Breaking news, you're hearing it first. Just eat more Reuben sandwiches.
I do like a good tempeh Reuben sandwich. Now we're both hungry. You're probably hungry too. We better let you go eat some fiber and beans and green stuff.
All right. Well, we will talk to you next time. Thank you for tuning in to the Diabetes Podcast. Thanks for listening to the Diabetes Podcast. Next up is part 2 of our 12 core dysfunctions recap, or you can always check out the original episodes if you want greater detail. Until next time, take courage. You can do this, and we can help.